Good afternoon, everybody. I feel incredibly honored to be invited to speak to some of you twice because I was here yesterday participating in the chronic disease portion of the pre-meeting. So I hope that it's not too repetitive for those of you that were in that session. I've also had the great opportunity since I've been here for a day to speak with many of you about the actions that you're taking in the arena of obesity prevention and control. And I've learned a great deal about some really fantastic work that you're doing. And I want to offer CDC as a resource to you as you're thinking about strategies and approaches. If we can pull the research together for you or be helpful in some way, please let us know. So we would not, any of us, be here, and certainly CDC would not be involved in working on this issue if there weren't significant health concerns associated with this disease. If this was a cosmetic issue, none of us would be here having this discussion. But unfortunately, the impacts of obesity are substantial. They're substantial in health arenas that are very pervasive in this country. Issues like hypertension, heart disease, stroke, issues around some cancers. And unfortunately, the impacts of obesity start rather young. With our youngsters that are obese in their early years, these health diseases aren't delayed until adulthood oftentimes, but actually start showing up during childhood, so that you'll see young children with hypertension, with type 2 diabetes as a result of their obesity. In some senses, the obesity health risks actually show up quicker than those that you might see from tobacco. Not only, although the health issues are probably paramount on our minds, certainly the cost issues are to be reckoned with. Obesity-related health care totals $147 billion a year. We've been seeing, of course, the health care costs in this country skyrocket over the past couple of decades, and the estimates are that about a fourth of those increases can be attributed to the increases we've seen in obesity. And medical expenditures for obese workers range between 30 and over 100% higher. So the impact on business and personal coverage issues in terms of health care costs are substantial. So I want to run through just a set of slides that maybe were those slides that brought this issue to the greatest public awareness. We released about this time, late 80s, early 90s, a set of slides that we began to just roll year by year and show what happens to the adult obesity rate in this country. And I think the visual impact of this really got the word out in terms of public awareness of obesity. So we start out here in 1990 with most of the states in the light blue area of under 20% obesity, more in the range of 10 to 14%. And as I just flash through these slides, they're increments of 3 years, each one that I'll show you. And as the colors darken and turn orange and turn red, the adult obesity rates are just increasing state by state over time. Up until the point of the current day where we have about a 30% adult obesity rate. So 1990, 93, 96, 99, we start adding colors to get up to the 25 to 29%. And here, the last slide that I present has some slides showing up in that above 30% range. So, unfortunately, these increases were true for children over the same time period, with obesity rates in children over the period of several decades tripling to the point that today about 17% of our children and adolescents are overweight or obese. The good news here, though, is these increases were dramatic and they were happening fast. But at this point, CDC has provided the data to show that basically these increases have halted for children and adults. This is very good news. While we need to turn these rates around to be sure, just a leveling of obesity rates after the kinds of increases that we saw for decades here is good news. The other data that we just recently released is the beginning of what looks to be a downward trend in obesity among some of our youngest and most vulnerable children. It was preschool data, ages 2 to 5, among low-income preschoolers in the country. And 18 states and 1 territory saw a significant downward trend in obesity rates among those youth. Very good news indeed. I have to say, though, that the declines were very small in nature, but they were the first declines that we had seen in a generation. All right, so why? Why are these changes? Why did they happen? Why did the obesity occur so quickly in this country? And most people, you know, there's no definitive answer to the question of why, but most people think that it's due to considerable social change in the country. A lot of people talk about engineering obesity into the environment in the sense that our portion sizes have increased, our eating out of home has increased, our thousands of processed foods and the availability of snack foods in every location, environments that encourage the use of cars rather than walking and biking. All of these changes were happening at the time these rates were going up. And I think we can all probably agree that personal willpower probably did not change over the course of these decades, although we don't know that to be sure, but it's most likely that with this surround sound of availability of high-calorie food and beverage products and difficulty finding locations and easy access to activity, that we've kind of engineered obesity into our life. Now, my talk today is going to focus almost exclusively on prevention, so I'm going to be talking very little about treatment issues of obesity. And that's because the Centers for Disease Control is known, or calls itself, I guess, the nation's prevention agency. And we're really focused on getting in front of these issues and preventing them in the first place so that we can maintain health over time rather than end up in a treatment situation. Now, granted, the whole continuum from prevention through treatment will be needed to deal with this issue. So even if we had, and what I think we're moving toward kind of re-engineering a healthier environment so that the healthy choices are easy, available, and affordable to Americans, and to make it easy to make the healthy choice. But I just put this up to recognize that don't put it past American ingenuity to figure out some way to remain sedentary despite our best efforts. So I do very much acknowledge that personal motivation and a desire to engage in healthy behaviors is very much required. I hope you can all see this because it's very ingenious indeed. The dog is being exercised while the human gets to drive the car. So really, the solutions surround us, and that's definitely where you come in. Thinking about things that can be, in terms of best practices, initiated in medical settings, initiated in schools, in our food retail, in our community design. So just quickly, you know, issues in the medical setting from a prevention standpoint, are physicians routinely measuring BMI? And then if the BMI is high, is there a discussion? Is there counseling? Is there referral to effective programs? In our schools and childcare, we've seen a lot of really positive indications moving forward with improved nutrition and beverage standards, to be sure. But increasing physical activity and improved nutrition in our schools and childcare, and including just easy access to plain and free water as a strategy, safe routes to schools to help kids be active on their way to school, and shared use agreements that keep the schools open for the community to use in the evenings or on weekends are some of the ideas being utilized in our nation's schools. Healthy food retail is a real challenge, especially in underserved areas. Thinking about getting fruits and vegetables into the corner stores and bodegas may be a solution. Doing incentive programs that draw full-service grocery into underserved areas. Setting up nutrition standards for vending and cafeterias and concessions. We established nutrition standards for government buildings, and those are now being adopted around the country. You could presumably possibly do the same in your state government areas. Farmers markets that are available and that accept WIC and SNAP dollars are an approach. Some of the farmers markets have double bucks programs where you can get twice as much product for your SNAP dollars if you're purchasing fruits and vegetables. And then community design, complete street issues, planning and zoning ordinances that help build in opportunities for healthy design, like the availability of safe parks, of complete streets, and the like. We do have for your use, and if helpful, a legislative database that shows all of the legislation and regulations that have been introduced in every state in the country over the past 5 years in nutrition, physical activity, and obesity. You can pick a state, you can pick a topic, you can search what's there, you can connect to the actual language in bills and regulation, and you can tell what has been enacted, what is still introduced, and what is dead at this point in terms of the legislation. So it's, I hope, a possible way to sort of keep track of what's happening around the country and some of the innovations that are going on. One of the most popular pieces of legislation that we've seen, and we continue to see more and more legislation each year on these issues, one of the most popular ones is the establishment of food policy councils or obesity task force. And I think about half the states in the country now have this kind of council available to them. But it's, I think, an interesting way to bring experts together from across sectors like transportation, agriculture, education, and the like, to really think through these problems at a local or state level and to try to design these solutions over time. Let me just quickly run through just some kind of fun things that have been done around the country, and then I'll wrap up and take a few questions. Kind of randomly selected of different things that are happening that may be happening, in fact, in your area. And if I highlight one state and not yours, it's not to say this isn't happening around the country. Nourishing North Carolina has a wonderful program of community gardens, and it's so effective with volunteer involvement that 2 tons of produce has been donated to food shelters in the area. Here's a number of locations, South Carolina, New York, and Michigan, that have complete street policies. And as roads are resurfaced, for example, bicycle lanes are put into place. Deb will probably be talking a lot more about these issues to follow. Healthier options at work. Getting, vending machines that have a line with healthy options at top or underneath, so that if you've missed lunch, you can get a healthy item out of vending. In this case, Ohio having impacted 15,000 employees with their healthy vending. Providing access to fruit and vegetables with here, Connecticut and South Carolina having their farmers markets able to accept senior and WIC vouchers, and putting in the EBT so that you can use your SNAP money at farmers markets. Omaha, Bicycle, bike sharing. This is happening all over the country. I know up in Washington, D.C., I've seen this underway as well. Borrowing a bike, returning it to any location. In this case, 850 riders already involved in the program. That's just a few examples, and there are hundreds of others where locations, cities, counties, and states are working hard to make their communities livable, attractive, and healthy. I think I'll end there, and I'd love to hear, if we have, I think, a bit of time, comments, things that are happening that you're working on, questions for me, or whatever, however you'd like to use our time together. Thank you.